studio with me is Dr. Lilian Munyasi. She's a consultant psychiatrist at the International Organization for Migration. Also with me on my immediate left is Dr. Mutisya, who's also a psychiatrist at the Mathare National Teaching and Referral. And we're talking about the World Health Mental, what am I saying? What is the correct?
World Mental Health Day.
World Mental Health Day. I got that initially right. I guess it's from all the talking with the president's arrival, but thank you for joining us. So the day in itself happens tomorrow. The entire month has been focusing as well on mental health. What is the purpose of this day?
Yes, the purpose of World Mental Health Day, which is celebrated globally, is to create awareness about mental health and mental illnesses to the public, and also give a platform for the people living with various mental illnesses to talk about it. And this year's theme is Living with Schizophrenia. And the national event will be held tomorrow at Mathare National Teaching and Referral Hospital, what people probably refer to as Mathare Mental Hospital. It will be, the chief guest would be the Cabinet Secretary for Health, and we are inviting all the members of public to join us as we celebrate the day.
Okay.
Yes.
Schizophrenia is what's the focus this year. What is that? Many people will be like, what's that?
Oh, schizophrenia is a fairly common mental illness globally, prevalence being only 1% of the population. And it's what we call a psychotic disorder, where one loses connection with reality. Okay, so the person may present with hallucinations where they are perceiving things that are not there, they hear things which are not there, see things which are not there. Or they can have what we call delusions, where they have false beliefs. Yeah, they may be paranoid. Paranoia can be one form of delusion.
Yeah.
And these people with schizophrenia tend to live with this illness long term. It's a chronic illness. Tends to be lifelong. So it can have its ups and downs, not meaning that one is psychotic throughout, but with medication, with treatment, one can be controlled, but it's generally a lifelong illness.
A lifelong illness, so no cure, treatment for that. Dr. Mutisya, is it really common? Because many people would not even be familiar with the word itself.
Probably people might not be familiar with the term, but in Kenya, that is what people will popularly refer to as madness, because these are people who are not able to tell real from unreal, and we don't allow people to use that word anymore. But it's quite it's common in the sense that if we are to look at Kenyan population, 1% of about 40 million people is about 400,000 people. So if we are talking about 400,000 people in Kenya living with schizophrenia, and we are not just referring to the people suffering from schizophrenia, we are also saying that the caregivers, the families, the friends, the neighbors of this person are also affected. So when you bring on board the caregivers and the families, then the number actually, because when you talk about living with schizophrenia, even if you're taking care of somebody living with schizophrenia, you actually in it, and you actually have to take a lot of work as you take care of this person living with schizophrenia.
Why the focus narrowing down to schizophrenia in specific for this year?
I think Dr. Siengo, who is with
basically the World Federation for Mental Health chooses a topic each year. The reason why they chose to focus on schizophrenia this year is because, for one, schizophrenia is one of the severe mental illnesses, and previously people thought that once you have schizophrenia, that is doom, and you can't thrive, you can't live better life. We are now seeing people with schizophrenia have better medication. They are able to take that medications with fewer side effects. So they are now living better, and we are now actually talking about, as much as we might not cure it completely, people can live normal life, they can thrive. So we are talking of recovery in schizophrenia. Recovery in the sense that you can live with schizophrenia and still be able to contribute towards the society, still be able to have a family, still be able to have a career, Yeah, basically. So we want people to realize now schizophrenia can be looked at differently.
So it can be managed, that's
Yes.
what you're saying.
Yes.
Talk to us about how that would happen and what a person who's taking caregiver of a person with schizophrenia needs to do to help manage that. And also the aspect of stigma, we'll get back to that, but first talk to us about management.
Well, management would involve first recognizing these symptoms. When you have someone who has lost touch with reality, like Dr. has said, then one would encourage the caregiver or the family member to seek medical attention. And in the public sector, Mathare Mental or Mathare Teaching and Referral Hospital would be the place for referral. Obviously, we have the primary care centers which have a referral system. So if this person can be taken to the nearest health center or health facility, then they would be referred to the Mathare Hospital.
Yeah. Many people look at Mathare with a lot of skepticism. They imagine, oh boy, that is now just a cuckoo house. Talk to us about how that you'd want that to change in terms of the perception. And also when you talk about first people will go to the immediate clinics or medical facilities, are there expertise there? Is there enough there to be able to even recognize that is the challenge, hence requiring such a referral?
Yeah, I would want to encourage the public that since Mathare Hospital was elevated to a national teaching and referral hospital, a lot has changed. We have now the second generation medication with less side effects, and we have more allocation towards patients' food, patients' uniform, and we also have had various supporters coming in, like we have Safaricom and Kenya at 50 who have renovated 2 wards. We have University of Maryland which has renovated a clinic for methadone to treat patients, people who are addicted to use of heroin. So a lot is happening. I know in the past we've been on the media for the wrong things, but we have many challenges. We are working on them. So I would welcome the public tomorrow to come and see the changes which we've already effected. Of course, it's continuous improvement. But when I talk about generally where to get mental health care, it's not just Mathare National Teaching and Referral Hospital. At the health centers, the nurses and the clinical officers have been trained to pick out and refer whatever they can't handle. Again, all general medical doctors, general practitioners, they are able to pick it and they are able to start the treatment and even do tests to exclude, because like if somebody starts seeing things which are not there or hearing things which are not there, we don't just assume it's mental illnesses. We need to rule out, could this person be having a brain tumor? Could this person be using drugs? So the primary doctor there will do those tests and exclude whether there's any other medical condition. Then if they are not able to manage, then they'll refer you to the where there's a psychiatrist.
Okay.
Yes.
There have been numerous cases of those suffering, especially say from schizophrenia, that will be locked up by their loved ones because then, managing that, taking care of them proves to be a challenge for many. In terms of stigma, even from society and people just saying this is a now hopeless situation. You've mentioned that now it can be managed and somebody can still have a fully normal functional life. But what is the message to eradicate this stigma that still exists?
Well, mental health mental illness is with us. Schizophrenia is with us. And it's not the end of life, like Dr. has alluded to. It can be treated, it can be managed. It is not being bewitched. This is a misnomer that people have. It is not majini. A lot of patients will come and say, ametupiwa majini. So we even in our day-to-day practice, we sensitize the patients and the caregivers that this is illness. Just like you can have diabetes or hypertension, which is a chronic illness, this is mental illness that requires long-term treatment, and it can be managed and controlled. Yes.
So eradicating that stigma, Dr. it begins with debunking the myths around mental health illnesses.
Yes, eradicating the stigma will begin by, first of all, people getting to understand what is this mental illness, what is schizophrenia, can it be spread from one person to the other? Can the person still be able to survive and live a fruitful life with it? So when people understand that, then the stigma is less. Again, when people come out and say, I am living with schizophrenia, and yet I'm able to manage my life, I'm able to work, I'm able to maintain my family, that also shows that you can have schizophrenia and not just collect garbage out there, get the right treatment, and be able to continue working. And tomorrow we'll be having 3 people living with schizophrenia talking about their real life experiences, what they have gone through, and how they are managing the illness. And I would encourage people to actually come, and I would encourage media to come and cover, so that the public can know having a diagnosis of schizophrenia is not the end of life, that you can live a fruitful life.
Are there other illnesses, and as far as mental health is concerned, that will then come about because of the pressures and stresses of life? Because more and more people with life, there are many challenges. Are there those, and how do you address that?
Yes, certainly there are other illnesses, especially stress-related. And from my setting, we have depressive illnesses or mood disorders, and depression being high on the list. We have anxiety disorders as well, also coming from that place of anxiety and stress. Given the stressful lifestyles that we all lead today. As for me, working in the IOM, we have a lot of post-traumatic stress disorder because of the group of people that I handle, who are people coming from a traumatized situation, people like refugees, okay? So from my setting, depressive illnesses, anxiety disorders, post-traumatic disorders, Daktari, I don't know whether you have any other but those are the main.
And those are the main. And
yes.
finally, as we wrap up, Daktari, maybe you can just tell us, because it's there, it's part of life that you'll have stress, you'll have all these other issues around. So what is it you tell people to manage that, to ensure that at the end of the day, we are of good mental health as a society?
Yes. Yeah, in fact, we say you cannot say you are healthy if you do not have mental health, if you don't have good mental health. And so, for one to be mentally healthy, they also need to be physically healthy. So the lifestyles which give you good physical health, exercise, eating good diet, making sure that you're controlling your weight, doing your medical checkup. Because again, if you have cancer, for example, and with a lot of pain, your mental health will also be affected. So if we promoted our health generally by living healthy lifestyles, then we will also be able to prevent mental illnesses. Again, when specifically it comes to mental health, people need to be able to manage their stressors, prioritize, see what is important in your diary, which you need to accomplish, do small goals and celebrate your achievements, not to take up so much, because people get overwhelmed by stress when they take up so many things. They are not able to tell, this is what I need to prioritize. So when we are able to manage our stress, again, avoid substance abuse. Because mood-altering substances like cannabis, alcohol, we are seeing many young people suffer psychological issues as a result of drugs.
Okay.
Yes.
Thank you both very much, and all the best tomorrow with the World Health Mental Day. Dr. Lilian Munyasi and Dr. Catherine Mutisya for being with us this morning. The day is going to be marked tomorrow at, where did you say it is?
Mathare National Teaching and Referral Hospital.
Mathare National Teaching and Referral Hospital. So if you can go and be part of that, get more information about mental health and more specifically schizophrenia. And they said there will be testimonials from people who are living full lives with the condition, and that it's possible, it can be managed, and it is not a sentence to a life of doom and gloom.